So how successful is modern laser eye surgery? It really is an extraordinary privilege to be able to deliver modern laser eye surgery. I've seen it evolve, and where we are now is using all laser technology for all components of the procedure, such that the risk of infection is minuscule, the outcomes are extraordinarily accurate, and the chances of having any kind of significant problem afterwards are really very small. To the point where if you're someone who wears contact lenses, for example, you've already embraced the concept of a small risk for an enhancement in lifestyle and convenience. Moreover, you've accepted an ongoing risk of contact lens related infection. And as we get older, all of us get slightly drier eyes, and the quality of your tear film is incredibly important for safe contact lens wear. So by definition, people who wear contact lenses over time, not only are they accepting an ongoing risk of contact lens related infection, but that risk is going up as time goes on and their tear film quality declines. Whereas with laser eye surgery, everything we use, everything that touches the eye is single-use, sterile, disposable. It's a one-off event, and certainly with small incision laser eye surgery, the surface is healed within 2 or 3 hours, and the patient's defences are back up. So the chances of getting an infection at that time are incredibly small. We're covering it with strong antibiotics as well immediately after the surgery. And once we've got the patient through that, they can enjoy great quality vision, independence from spectacles, and no contact lens wear. So if we consider LASIK laser eye surgery for short-sightedness correction and SMILE laser eye surgery for short-sightedness correction, when we've audited our own figures over the last 4 years, we've found that we've had no patients with 2 or more lines of lost best spectacle corrected vision, and we have a 2% enhancement rate. Let me explain those things. So best corrected vision is the very best sharpness of vision that we can achieve for a patient with any kind of lens. It's how far we can push them down the chart. And there is variation. We're not all wired up the same. Some patients, the most they can achieve is the 20/20 vision line, the 6/6 vision line. And whilst we talk about that as a good level of vision, it's an average, and there are many patients who can achieve a line or even 2 lines better than that, sharper than that, as long as they've got an appropriate lens in front of them. When we performed laser eye surgery for somebody, what we're after is really good quality vision without wearing their spectacles. And ideally, what we want to achieve is the very same level of sharpness that they could achieve in their spectacles before surgery, but they're achieving that without their spectacles afterwards. We and the patient would accept a slightly lower bar of very good vision with a small correction, and I'm an example of that. I have a small amount of short-sightedness in my left eye, so that if I compare the vision in each eye, I can see a line better with my right than my left eye. But if I put an appropriate lens in front of my left eye, I can unlock all the sharpness. So at the very least, we'll accept from our cases, our work is, okay, they've got the 20/20 vision line, but if I put in that tiny correction, which the patient doesn't need and they don't want, I can get all the vision back. If we can't achieve that, then that's a lost line. It's sort of gone off into the ether. So we're always working to eliminate that. And what we've been able to achieve is no patients with 2 lines, and only 2% of patients losing 1 line. So as a quantum of vision, we're really holding on to it for people. Then we have to talk about enhancements. So as I've just been mentioning, we may have some patients who have a small amount of defocus remaining after the laser eye surgery. And for most patients, it's a normal amount of defocus that you might find in someone like me who's got good vision without spectacles. But for some patients, because we're all unique, they'll heal in such a way that we're just a bit too far off for them to be delighted with the surgery. And I want them to be delighted. So for argument's sake, let's say they started out as a -6 prescription short-sighted patient. 3 months after the surgery, they are -0.75 in each eye. They'll have good vision. They'll be able to wake up in the morning and make themselves a cup of tea and see what they're doing, they probably, with both eyes open, would even be at the driving standard, but it will be slightly blurry. It'll feel like they benefit from a pair of specs, and we don't want that. I don't want that. And so once we're happy that the prescription is stable, that it isn't moving, then we will offer those patients an enhancement. And it's a very straightforward return to the laser. With LASIK, we just surgically find the edge of the flap and lift it up. Tiny ablation, and it's incredibly accurate because it's such a small amount that we're correcting. And also the patient's flap is in place. We're measuring the eye with a flap as opposed to the virgin eye before the initial treatment. So this is incredibly accurate, and it can secure that last bit of sharpness that the patient's after.